Well, certainly, as I mentioned before, whenever you're talking about policy changes, there's winners and losers, and that often puts dollars on the table for people who want to come and push their viewpoint. I think that one of the best ways to do that, if you're feeling that the concerns that you have aren't part of that, is to try to find those natural allies. A lot of the environmental organizations have, or some of them have positioned themselves as being more willing to work with industry, more willing to work with agriculture, looking for those win-wins because they're frustrated with being at loggerheads all the time too. That's some people like constant conflict, but that's not most people. So, you know, there's not lots of low-lying fruit out there, but I think that's often where the conversations can start. And you know, I do think that conflict-driven lobbying part of it's not going away anytime soon. And I think that the best we can hope for is for other forums such as this one to be opportunities to come. You know, that's not a very intricate answer, I guess, but I don't see that part of it going away.
I'll just reach back out to Dr. Jennis. This idea of the exposome. If you were thinking about the role that it plays, will it be able to change people's habits? Are people going to start thinking differently about the things that they either are taking into their bodies or the things that they're doing differently? It seems like people want more experiences rather than limiting themselves these days.
Thank you for your question. I'm sorry, I'm not an expert on human behavior in terms of how people will respond, so I don't know that I can answer that adequately, but let me comment about the idea of the exposome in relation to food. This concept of the exposome, and that is the totality of environmental factors from conception onwards, is getting a lot of attention because it's being found, for example, that even the nutrients that women consume during pregnancy may alter the manifestations of their genetics. They've taken some animals, for example, and they, with the same genetic makeup, and have given them different nutrients in pregnancy, and they may manifest different coats or manifestations. So this idea that we're fixed genetically from when we're conceived is going out the window also. So the exposome from conception onwards, it's having a profound impact. I really believe in sort of, you know, Nelson Mandela's admonition about education being the greatest tool in terms of changing the world. And I really have faith that if we begin to educate the community and our young people in schools, that this concept of, you know, being responsible for your health and impacting your exposome in a positive way from, you know, from pregnant women on can have a profound difference. And just I'll close with saying, in our office, for example, I work with another doctor and she specializes in what's called preconception care, because it's been found that what you do in pregnancy has profound long-term health, because they're now discussing fetal origins of adult disease. And so we take women in our office prior to them wanting to conceive and educate them about healthy things that they can do. This has been done in the UK with remarkable success. So I think there's lots of exciting opportunity. Thank you for the question.
Thank you very much. Other questions or comments? Yes, please.
Thank you. My name is William Yan. I'm from Health Canada. And first of all, thank you to the panel for your great presentation this morning. The panel seems very far away.
They are here.
I have a couple of comments and a question, I guess, more for Dr. Jennis. I think what we heard this morning really highlights the complexity of the issue that we are facing. And I think one thing that's clear is that food definitely has a role to play in chronic health and how we can improve our healthcare system looking in the future. Now, having said that, Health Canada plays kind of a unique role because to some people, we are the big bad regulators. For others, we could be maybe potentially enablers. But Dr. Ma, you said the food supply system is stressed. Well, I can assure you that the regulatory system is even more stressed because we're always challenged with new technology, new challenges. And I totally agree with Dr. Anderson that the only way we can succeed is by collaborating. And that means the agri-food sector, the regulators, the industry in general, and also the medical community as well. Now, some of the things we can do to enable is, you'll hear this afternoon in some of the talks that we've tried to modernize our framework to enable health claims on food. We've tried to make our approval process more effective for novel technology, for new crops that have added health benefits. But we also have to play the role of the oversight, because we've got to make sure that all those health claims and all those products that hit the market have to be based on science. They have to be, the claims have to be truthful, they cannot be misleading. So we need to work with industry to do that. Now the challenge we face is also with the consumer, because consumer play a huge role in this area. And Dr. Cash, your presentation highlights that, marketing, labeling, there's always challenge to try to convey scientific information in a way the consumer can understand. And labeling is a great tool, but it is not simple. So all that leads to then some of the challenges that we face, and Dr. Janice, I'd like to get your input on this. You gave some really good examples of how, increasing certain nutrient levels in the food supply could go a long way, potentially in preventing chronic diseases. But we're always struggling sometimes with differentiating between the level that you need for acute care for a patient and the level that is appropriate in the food supply that gives the entire population overall protection against chronic diseases. And sometimes those levels can be quite different, because everybody eats the same food supply, whether you are diabetic, whether you are, people have a chronic disease, or you are in general good health. So for Health Canada, it's really difficult for us to decide what is the right level for the entire population, when we know that certain subpopulations need a lot higher levels. And I think that's where we need a lot of dialogue between regulators and the medical experts like yourself to determine food clearly plays a role, but how do we use that as a vehicle safely?
Thank you very much. The question.
Thank you very much for your comments and questions. Many really, really important things that you brought up, and I really appreciate it. As you say, even if you gave everybody in this room a certain amount of vitamin D, it doesn't mean that they're all necessarily going to have the same level. There's many, many determinants that will affect it. So it is a more complex thing that needs to be worked at with people in that area, and so that's a long discussion. But if you ask me with regards to recommendations for Health Canada, I think that the one area that I think could make a difference is the area of knowledge translation, KT as we call it. The information that I presented today, it's not my work, it's the great work of other people. I was just the communicator, just letting it, it's all there in the research world. But historically, the process of knowledge translation from time of information being there to the average person knowing about it is 1 to 2 generations. For example, when I went to medical school, I was taught that ulcers were caused by having too much stress, a dominant mother, and a passive father. Okay? Well, I had a very dominant mother. I hardly saw my father, and I had a lot of stress being in medical school. I could feel the pain when they lectured about it. So the reality is that that's what we were taught, and they had various medications and surgical procedures for correcting ulcers. In 1983, there was 2 fellows, Warren and Marshall, from Australia. And they found that it was related to a germ called H. pylori. But they got so much resistance. Barry Marshall got so upset, he presented at a conference in Brussels. And even though he had all the science, people just sort of dismissed him. So he took a bunch of H. pylori himself, confirmed it on X-ray, and then treated to try to show people. But still they were ignored. They didn't achieve consensus in the medical community till 1994, 11 years later. And still, in 1997, the Center for Disease Control, was finding that doctors were still using the old stuff. And so they started a campaign. But what they did is they went to the public to try to achieve knowledge translation, not just going to the medical community. And here in Alberta, there is a great example of how that can work. Some of you may be familiar with a program called Do Bugs Need Drugs? It was carried out by Edith Blondell Hill at the University of Alberta. She tried to educate the medical community about the excessive use of antibiotics and how this was very problematic. But the medical community, unfortunately, just wasn't running with it. And so, with a certain degree of frustration, she decided to achieve knowledge translation a different way. So she hired a bunch of university students, gave them a course to go into grade 2 students at schools, 7-year-olds. And so I think it was Grand Prairie that they went to. And they went in and they just taught these students, if you have an infection, most of the time it's a virus. You don't need antibiotics, and these are things that you can do. So, as you say, going directly to the consumers, right, and gave them information to take home to the parents, right? And so, dissemination of knowledge. So, overnight, the use of antibiotics in that community changed. It plunged immediately. So, what I would suggest is to take some of the emerging information and disseminate it by various means through the educational system and the media, whatever, directly to people, so that they then will go to their health providers and to professionals and say, do I really need this, or how should I be eating this way? I think that that's an established, most effective way of doing it. Thank you.
Thank you very much. Thank you for your patience. A question on this side, and if others want to line up, you're also welcome.
I'm Michelle Heffernan from Trace Associates, and I'm also AIA council member. We heard a lot of words this morning about gaining public confidence, respecting public safety, making sure that we have information from competent individuals who are also acting ethically on the public's behalf. I see a good opportunity there that overlaps with our mandate at the AIA. And if you look at the demographics that were provided in the information yesterday, the actual number of registrants at the AIA or members is really, really low in the food industry. So we also talked about trying to find a common ground where food safety professionals as well as agricultural professionals can get together and have an opportunity to come up with some solutions together. And again, I see AIA as that gap where we have folks from both schools of thought. So I guess my question would be to Dr. Stewart, with the new meat inspection legislation coming through, do you see an opportunity for requirement for those inspectors to have a professional designation and be using folks such as ourselves?
Not to burst your bubble, but I'm going to have to say no. In terms of having an actual inspector present at the plants to have a designation, I don't think would be required. They would have to go through the training program that would give them the tools to be the inspector for visual effects as well as the new surveillance tools that are coming down the line. Having said that, that doesn't preclude the opportunity for the AIA to interact with the government, to work together to try and find areas of commonality. That would be one suggestion I would have. And the other is, there is the Alberta Food Processors Association out there who's quite active in promoting food safety. And if you want to have a quick conversation after, I'll certainly provide you with the name of somebody who you might want to contact to try and build that bridge.
Thank you.
Thank you very much. Yes, on this side.
A question to all the panel members. Very exciting presentations, new technologies, new research are coming down too, that it's going to be fantastic, I think. The question that I have for all of you is who's going to be the gatekeeper for all the information and technologies that are coming to us?
Sounds like that's across the board. I don't know who wants to step forward first. The gatekeeper, Dr. Anderson.
Yeah, I don't know where to start on that, really. It's thanks for that question. It's really complex. We don't have any gatekeepers. I think that's right. And I was thinking, you know, this KT, all of our research agencies want us to always build into our grants knowledge translation. What's that? That's tended to create newspaper articles. You know, how many times do we hear that there's a cure for cancer? There's vitamin D will cure every disease. I don't agree with that at all. And there's no proof of it. But then Health Canada gets pressured, you know, that's for, you know, discretionary fortification because vitamins are so good. And since I do epigenetic work, I'm going to just mention something. We've been feeding, well, starting about 15 years ago, a grant from the CNHR. I actually thought maybe Americans were more fat than us because they had discretionary fortification of vitamins throwing out more in the food supply. And I was an advocate for having kind of the same levels in breakfast cereals. In Canada, it's US, and more flexible fortification. Anyway, so what we did was feed the mother rats just during pregnancy. Roughly the amounts of vitamins that a lot of women during pregnancy are taking now, which are well above the requirements, folic acid as an example. And if she only got those vitamins during pregnancy, all her kids got fat. So they have the same genes, but it's the epigenetic story. Then if you give the kids the high vitamin diet, it changes their epigenetics again. We are going through these changes depending on the environment, basic genetic expression. But it seems to me that everyone's so willing to jump out and be the expert and get some media. And there, of course, people that are tremendously good at communication, like I mentioned, Davis and Parmeter, which kind of messed up the grain industry without. But again, you know, there's a lot of technology that who's going to be the gatekeeper, but I think you still have to go back to the fundamental point of doing nothing is not enough in terms of what your system is trying to produce. So just what we've heard about meat inspection as part of the McCain's Maple Leaf story, working with the advisory committee, you know, the big issues such as food safety, or in fact, dealing with an acute disease, trump everything. And that's where the resources go. And that's, I'm sure Dr. Mao will back me up. And that's why it's so hard to have good people in, have people in public health with the same resources that the treatment has. And so I think we have to go back to thinking ahead in terms of building public confidence, of having research in place so you can immediately combat the stuff like wheat belly, you know, and being more, protect the basic crop and protect its use. I mean, with pulses, tremendous advantage to add value-added ingredients across. And you know, instead of just say there's junk food and snack food out there, why not make healthier foods using your crops? And that's where the processing and the engagement should come about. So, but yeah, I mean, people seem terribly adaptable to jumping on something, and you know, there was Ian Tyson, obviously not the country singer, he's an astrophysicist, and he said at the planetarium in New York City, and I saw him, you know, he was being interviewed, and he said, you know, at least they have some solid science, and that's why he's an astrophysicist. He said, the problem is we've gotten to the point where no one wants to believe the science, and there's other, so I don't think there's a gatekeeper on the science and the knowledge. It's just so many forces come in. But I still get back to, I think there's an opportunity for the agri-food system to build up more trust, more confidence by linking across with the medical system and Health Canada. You people talk about partnerships, but believe me, in medicine, they don't want partnerships. It's really hard to convince them that you need the food system involved, and you need industry involved. It's the biases, and that's why I disclose my conflicts of interest. I have to do that for a medical lecture. So that's
Understood. Last chances for other questions. Yes, on that side.
It's Eric Jorgensen. I'm a farmer, a health advocate, and a county councillor from Fort Moy Way up north. I'd like to thank the panel from right across the country for this wonderful explanation of what you're trying to do, bringing the vision of all things are related. My question will be to the panel generally, I guess Dr. Genus and Dr. Chan, and also Dr. Glade, and the fellow that's not here that would like to have seen here was Chancellor at U of A by the name of Dr. Carl Amrine. He is now the board for Alberta Health Services and trying to replace the board. So I know that the people from U of A would know Dr. Amrine. Dr. Ellen Toth, over 10 or 15 years, have done research across small communities with regards to chronic disease management. I had a chance to talk with Minister Mandel publicly about where this MDSI, the Mobile Diabetic Screen Initiative, is going. I see what Dr. Chan was talking about, getting to the grassroots, out to the people. And I had a discussion with Darcy out front here about the comment about methotrexate and vitamin D and omega-3 acids. And I've got personal connections to that. My father's gone through that, and I wondered because he backed away from eating eggs about 15 years ago because everybody was scared about cholesterol. You know, is there something that can be done there? Dr. Amrine is incredibly effective with what he's doing. Can the people that are on that panel and Dr. Glade and Dr. Amrine get together so that something like the MDSI that was out working with the people at grassroots level to ensure that when they do a blood sample, they also check for omega-3 and vitamin D levels?
That is a very long question, so I'm just trying to think about the substance of it. Is someone familiar with the particular study? Because I am not. Does anybody have any? I don't know if we exactly got a specific question there.
It doesn't have to be MDSI. I just made that as a connection so Dr. Amrine and the university are tied into this discussion as well. But it's the idea that was brought forth, the health of the people. In some cases, it'd be quite simple to identify, which is in a blood test. I try to get my annual checkup done. I'm not good at it, and they do take 2 vials of blood every time. Can you tie that in with some of the comments that were made about health and things affecting our genomic bias?
I can see Dr. Bond ready to jump in. I will just say one thing about Dr. Amrine. You are correct, and we have actually had discussions with him. He's now the sole administrator of Alberta Health Systems. As you know, his budget now is about $19 billion, and we think that there is a real possibility for the kinds of concepts that we've heard this morning to get ahead of what it is that we're spending in our healthcare system in this province. But please, Dr. Bond.
Yeah, I just had a brief comment, and maybe it's actually just linking this question with the earlier questions. But I think one of the key pieces to this is not only the idea of KT, but I think what you're talking about is linking upstream innovations with downstream evaluation to really kind of connect the people that are working on either ends so that we're actually measuring and documenting the downstream effects of those types of changes. And so I guess how it ties in is I was thinking about the earlier questions and sort of the ask to Health Canada. And I think, you know, the big role that Health Canada can play here is really to optimize, to make sure that measurement and assessment and evaluation actually links those different players across the system that Health Canada, you know, speaks to on a daily basis.